how to do a vestibular rehab for a patient who is falling again and again, or a patient who is having a gait disorder, or a Parkinson disorder, or a patient is suffering from spinocerebellar ataxia and is falling again and again. So let us start. Hi. So in this section, we will be talking on how to do vestibular rehab for a patient who is falling again and again. So we will be talking about special complaints of patients, then how to do center of gravity muscle strengthening exercises. Then we will take multi-sensory training, which will include gaze stabilization, vision and vestibular exercises. Then we will take up postural training exercises, in which we will be talking about ankle, hip and stepping exercises. In the end, we will take endurance training exercises, which will strengthen the upper body and the lower body of the patients. In the last, we will see few exercises which the patient can do while lying in bed or standing. So our main aim is to make the patient from a sad or depressed one to make him walk and be happy, and then make him run again, and if possible to make him happy and jumping again. So let us start with some special complaints. The patient will come to you with a difficulty of how to get up from a chair, and how to get up from a bed, or how to pick up any object from the floor. So for getting up from a chair, first thing they should do is they should place their hands on the armchair, then bend forward your trunk and lift yourself, pushing on the chair's arm. Then they have to start looking at the front and then wait few seconds before walking. The next complaint is how to pick an object from the floor. The patient should push the object near a table or any kind of bed or support. Then using the table as support, they have to bend their knees and pick up the object. Make sure that they do not bend their head too much, and you tell them to start bending your knees and getting lower, and then pick up the object, and then lift yourself using the table as support. Third is how to get out of the bed. First thing is they have to turn to one side, then start with your legs, move your legs to the side of the bed, then lift your trunk slowly while taking the help of a hand, and then sit fixating in front of you, wait for a few seconds before standing up. So coming to the initial and the most important steps which you have to do. First is you have to listen to the patient. Note their major concerns, like I may fall, or what I'm going to do now. You have to explain their concerns. You have to reassure them. You have to tell them what precautions they can take. Then you have to explain them why this patient is referred to you, and explain the particular disease they are suffering from with the help of diagrams and videos. You also explain them what investigations were done, like pivotal audiometry, WEMP, BERA and VNG, and explain their role in this disorder. Explain what you are going to do, give them printed schedules and objectives, and explain them that their 100% participation is needed to get rid out of this particular disorder. And you have to also make sure to explain that 100% reversal may or may not happen, but significant improvement is very much expected. And you have to also tell them that how I am going to do a follow-up and how I am going to monitor your progress. Most of your patients will be suffering from these features. First one is vertigo or dizziness, then anxiety or depression, vomiting and other vegetative symptoms, imbalance, disturbed quality of life, and recurrence. Give most of your time to symptoms from 2 to 6, like anxiety, vomiting, imbalance, disturbed quality of life, and how to handle the recurrences part. So then You have to be familiar with them, ask about their job, family, day-to-day activities, tell them about yourself, make them comfortable, tell them that you understand the particular disease. I understand the patient's feeling and that you care for them. You identify the aggravating factors like other particular diseases like hypertension, diabetes, kidney failure, etc. You have to mention them about alcohol or smoking also. You have to give them a chart so that they can make the dietary modifications, like you have to drink 2 liters of water, low calorie intake should be given, you have to do a decent breakfast at a particular time, light lunch, coffee should be avoided, etc. And you have to also give them tips to control the stress, which can be meditation exercises, tai chi and yoga. So let us start the center of gravity muscle strengthening exercises. So as you remember from the previous video, in the assessment part, we can easily pinpoint which patient need the center of gravity strengthening exercises. So now we will take each of those exercises step by step. The main agenda is to maintain a better upright position, whether seated or standing. Then lean away from and return to the center position and move the body through the space more quickly and confidently without having a fear of fall. So the first exercise which we should give to the patient is while they are seated. So you can use a chair or you can use a ball. Chair is more stable, and make sure that you have the chair which has handles or hands attached so that they can hold on to the hands and then they can do the exercise. But I would prefer, if a patient is able to do the easy exercises, you can pick up the ball. So first is they have to just sit on the ball. Second is they can raise their arm one by one, and if they are able to do, then you can make them raise both of their arms for 10 to 30 seconds. Then they have to also extend their arms in a diagonal fashion. If they are able to do, then we will ask them to do the leg exercises. So in first thing, we will ask the patient to lift up their toe, as you can see in this diagram. Then we ask them to lift their heel while maintaining the position, and then we ask them to raise their leg one by one and then extend and then raise the legs while maintaining the correct posture. Then we will ask them to do the trunk movements. So first one is, you can ask them to look behind while moving the whole trunk to right side or left side. Then they have to lean forward and backward. Make sure that you are very near to the patient so that you can hold them. Then you can also do the diagonal trunk movement, so that in this you can see that the patient is moving the trunk in a diagonal variation. You can also use the resistance band for these particular exercises. So next, if they are able to do all these exercises while sitting, you can start doing the exercises while they are standing up also. In the center of gravity strengthening exercises, we generally make the patient stand up in the end and we push them. So we can see that how he is able to resist the perturbations. So there are two kinds of perturbations. First one is predictable, that I will say to the patient, so sir, I am going to push you from the left side, you have to maintain the balance. Then I will push you from the back, you have to maintain the balance. Make sure that they don't fall. Second is unpredictable, in which you ask the patient to close their eyes and you may push from back or left or right, and then they have to maintain the balance. So this is resistance exercises. Then they have to stand erect with open eyes, and you can do these exercises when the patient is standing on foam. Then you ask the patient to close the eyes. Then you ask the patient to do something with the upper body, like you ask them to fold their hands to their trunk, and then you ask them to read while walking, and they can do multiple exercise also, multiple varieties of exercise, like they are holding their hands and they are walking in a tandem fashion, or they are just walking while looking at a different object. Then coming to multi-directional weight shift, in which they have to start bending forwards and backward. They have to do the lateral weight shift, in which they are just moving to the right side and they are picking up any object, like pulling up, cleaning the garden, cleaning the cupboards, and using the washing machine. So these all things are mandatory for the patient if they are able to do the other things. So this is known as multi-directional weight shifts. Now coming to floor to standing transfers. So first they have to lie down, as in picture A we can see. Then they have to start raising their one leg. Then they have to take a turn, and finally with the help of their hands they have to get up from the floor. Then they have to bend like this, and taking a support from the chair they can easily get up. So there are other variations of this also, so you can modify these exercises or these sets according to the patient. Now coming to multi-sensory training. So in this, the first thing which we will talk about is the gaze stabilization test. So again, the patient will be standing looking at you, and then we ask the patient to close their eyes. Then we will ask the patient to stand on foam with eyes open and then with eyes closed. Then we ask the patient to hold a ball or hold any object and follow the object which is moving. So in this particular thing, we made the patient follow the ball while the ball is moving in a horizontal direction and is changing the hands. So from the left hand side, the subject is actually moving the ball so that the ball is now in front of him, and then the left hand is taking the ball and moving it to the extreme left side. Similarly, you can do it for vertical also. So the next is we will give the patient specific tasks which are related to gaze stabilization. So we will ask the patient to look at a particular object or look at a chart or look at a particular diagram and follow the diagram and try to play with it. So in this first example, we can see that the physician is actually holding a ball and patient is asked to pick that ball. So the physician will be changing the position, and in the second diagram we can see that the patient is fixating on a particular object or a particular diagram in this whole chart. So this is very important for gaze stabilization exercises. Next is you can do the Saccard's test, in which we ask the patient to extend both of their arms in front in the horizontal plane and try to look at right thumb and then immediately to the left thumb. So they have to repeat this exercise at least for 15 to 20 times, and they will feel a little bit dizzy, but still you have to continue these exercises. Then you can do this for the vertical plane also and ask the patient to repeat this exercise. This is a very good exercise for gaze stabilization. Then coming to vision and vestibular system exercises. Again, this is a part of gaze stabilization. So we ask the patient, if he is lying down in bed, we ask the patient to look at a particular object In this case, there is a sticker which is placed on the left hand side of the patient, and the patient is advised to look it for at least 30 seconds. So if he is able to look at the sticker for 30 seconds, we ask the patient to look at it for a longer period of time. Then while sitting also, the patient can repeat the particular exercise. Then again the saccades, and if he is able to do all these exercise, then we make the patient stand up on a foam to increase the difficulty level and then do the exercise. In the end, we can ask the patient to walk and follow the particular sticker. Now let us force the vestibular system. So in this we can see that the patient is sitting on a ball, which is quite difficult, and then we have removed the proprioception from the legs also. The patient is again, the legs are placed on a foam, and now the patient is doing a juggling exercise with the ball. So in this way we are actually forcing the vestibular system to come into play. So similarly you can ask the patient while sitting to pick a ball from the ground and then place it above their head while following the particular ball, and then place it down again. And then you can do this in the horizontal direction also. If they are able to do while in the sitting position and in the standing position, then you can increase the difficulty level by placing them on a foam. Then in the last, we can ask the patient to close their eyes while they are standing on foam and do the resistance test, in which the physician will be pushing them in one direction and they have to maintain their balance. Now coming to the very important part, ankle, hip and stepping exercises, which is in postural training. So we can place two chairs or we can stand behind the patient, and we have to ask them to lean forward and then lean backward. In this, actually we are strengthening the ankles. So there are few resistant bands which you can buy directly from Amazon. It's quite cheap, and there are different levels of resistance also. So green one is very light and the black one is very heavy. So you can use these bands to do the resistant band exercise, in which you place those bands like this in the foot, and then you ask the patient to flex the ankle and extend their ankle. So this is the resisted plantar flexion exercise, and then you can again ask the patient to do a flexion and inversion of the ankle. So in this way we are actually strengthening the ankles. Then we can also do dorsiflexion and eversion. In the end, if you see that the ankles are strengthened, you can ask the patient to write any letter with their ankles while they are sitting on a bed. So the patient is sitting on the couch and he has to make this letter A just by the tip of the toe. And we can ask the patient to repeat this exercise when they are at home for 5 times or 10 times in a day. Next is, we place them on a foam roller, and then we ask the patient to bend down, bend forward and then bend backwards. Please note that in this, the upper part of the body is actually facing front, while the back of the body or the lower part of the body is pointing towards the other side. So this is the actual correct way of doing these exercise. Then we can use the resistance band again, and we ask the patient to move forward while we are actually pulling them via the resistance band, and then we have to make them go also. So this is the release of the maneuver, of the stepping maneuver. Similarly, we can do when the patient is actually sitting or standing on a small step, and we can repeat the exercises. Similarly, we can do the backward exercise also. So when the front back is over, we can start with the lateral stepping exercise also, in which we can use the resistance band, and we ask the patient to move to the left side by taking multiple steps and then move to the right side by taking multiple steps. You can also ask the patient to do different stepping strategy, like you can ask the patient to place their one leg in front of the other leg and then move, or else they can move by placing one leg beside the other leg also. Now coming to the endurance training of upper body and lower body. So the first is, we can ask the patient to do a simple shrug of the shoulder with some hand weights. It could be half kg to 1 kg to 5 kgs also. Then we ask the patient to do a head extension and while resisting it with their hands. Then we can do side to side bending with hand weights, and then we can also ask the patient to pull the resistance band with both of their hands. Similarly, they can also do the standing chest press with the help of resistance band like this. Next is, they can lift the ball which is placed on the ground while they are sitting on a big exercise ball. So they have to pick up the ball and then make it go up of their heads. You can increase the weight of this ball also, so that now the upper body is taking more of the resistance. Then you can also use the resistance band for doing biceps curl. If they are able to do it while sitting, then you can ask the patient to do it while standing. There is a smiley ball which is generally used for palm squeeze, and it is very helpful for the patients to just do the palm squeezing exercise. Coming to the lower body exercise, in this we ask the patient to stand with taking the support of the wall, and then get down like this and then get up again. So from standing position they will come down while taking the support of the wall, and then again they have to go up. It is a little bit difficult exercise, but you can ask the patient to do it once or twice, and then you can ask them to repeat it for 10 to 20 times. If they are able to do that particular thing, then you have to ask the patient to stand from the sitting position and then do a squat, and then again they can sit. Similarly, you can ask the patient to stand behind the chair, and while wearing some weights on the legs, they can do the leg curl. Again, you can ask the patient to do a leg exercise, like leg extension exercise, while they are sitting on a exercise ball. Then you can ask the patient to do a standing forward lurch, and then you can use the resistance band to increase the strength of their ankle and the knee joint. This is a very easy exercise in which we place a ball between both of the knees of the patient, and we ask the patient to crush it or to compress it completely. Similarly, with the help of a resistance band, you can place the resistance band like this, and then we ask the patient to extend their knees. Not extend their knees, to open up their knees while the resistance band is providing a resistance. Now coming to the last topic, which the patient can do very easily. So in the acute phase, generally the patient are not able to get up, sit or stand. Then these exercise will help the patient. So they can hold the right knee against their chest for a few seconds, and then they relax the right leg. Similarly, they can do it for the other leg, and if they are able to do the right leg and left leg, now they can do they can start doing both knees simultaneously. So they have to hold the knees together and very close to the chest and then release. The next is they can move their hip to right side and left side like this. This is a very easy exercise and it will strengthen the hip muscles. The last thing is they can actually do this Elvis style dancing steps with their family members or with their kids, and this is actually helping most of the muscles of the patient's body. So this can be a fun activity, and this they have to do it for at least 30 seconds to 5 minutes if possible. So this is a very fun thing to do with the family members, and the patient will not feel that they are actually doing a exercise or they are just enjoying the particular thing. So this completes the vestibular rehabilitation for a frequent faller. Thank you.